Okay, everyone, this is our last class, our last lecture for microbiology, BIOL 2010 at Corning Community College. So we've come all the way to the end, and our last chapter is going to deal with kind of a mixture of different infectious diseases. We're primarily going to look at the skin, nervous, and genitourinary diseases. All right, so let's start with diseases of the skin. Now, of course, different microbes can cause different things here. What about bacterial diseases of the skin? Now, most commonly, bacterial diseases of the skin are caused by Staphylococcus aureus. We've seen that one several times now, or Staphylococcus epidermidis. They are transmitted by direct contact or through fomites, objects. Okay? Staph aureus and Staph epidermidis, but especially Staph aureus, possess structural defenses that help protect them against phagocytosis, and they can actually cause a whole range, a whole host of diseases throughout the body, including things like osteomyelitis, it's infection of the bone tissue, pyomyostitis, infection of skeletal muscle, okay? Folliculitis, infection of hair follicles, we commonly call pimples, boils, or styes, okay? And cellulitis, infection of the dermis, or underlying tissues of the skin, we see here. Acne, numerous blackheads and pimples typically on the face. This is caused by not so much a Staphylococcus aureus, although that can be a cause, but another one, Propionibacterium acnes. So a whole host of diseases throughout the body caused by this Staph aureus, potentially Staph epidermidis. Remember, these things can be part of your normal microbiota as well. Now, another bacterial disease of the skin is necrotizing fasciitis, which you may have heard called flesh-eating bacteria. This condition is caused by several bacteria, but the main culprit is Streptococcus pyogenes, a group A Streptococcus. It invades, consumes, and destroys body tissue, as shown here, literally eating, consuming the flesh. Can enter through breaks in the skin, causing hot, extremely painful rashes at the site of infection. Necrotizing fasciitis, everyone, is a very, very, very serious medical emergency, often requiring amputation to stay ahead of the infection. It can kill in a matter of days. Pseudomonas infections are another bacterial skin infection. These occur when the skin is significantly compromised. So usually this is found in burn victims. It's caused by an opportunistic pathogen called Pseudomonas aeruginosa that invades the bloodstream. So this patient here, this is showing a Pseudomonas infection of a burn victim. This infection was caused by bacteria growing under the bandages. Okay? Gas gangrene. We've talked about that one before. Now, this really starts if we have the blood supply to a particular tissue or area of the body. If that blood supply is interrupted due to a wound or something else, the tissue becomes anaerobic, oxygen poor. All right, this is a condition called ischemia. When tissue doesn't have enough oxygen, it dies. This is called necrosis, tissue death. Now, as tissue starts to die, that creates good conditions for this bacteria, who we've seen before, Clostridium perfringens, to infect that dead tissue. It then produces toxins that kills surrounding tissue, leading to a condition called gangrene. Okay? This is also a medical emergency because it can quickly lead to sepsis and then death. All right? Treatment, antitoxins, plus IV antibiotics, and even removal or amputation of the dead tissue. What about viral infections of the skin? Most viral skin infections are systemic, but they show symptoms in the skin. They're spread by respiratory and oral routes primarily. Pox viruses would be the most well-known. All of these produce lesions on the skin that kind of progress through stages that get bigger and bigger and fill with more and more pus and fluid. Smallpox, cowpox, monkeypox, like pictured down. Remember, smallpox has been eradicated, but cowpox, monkeypox has made the news again recently. Okay? Herpes is another viral infection of the skin. This is caused by human herpes virus 1 or human herpes virus 2, causing painful, itchy, slowly spreading skin lesions. If this is on the lips, we call them fever blisters or cold sores. On the genitals, it's genital herpes. All right, here we see those cold sores. Now, both of these viruses can go dormant, but they're reactivated periodically in 2/3 of patients. The mode of transmission is either direct contact for herpes virus 1 or sexual contact for herpes virus 2. There is treatment with antivirals, but currently no cure. What about warts? Okay. Warts are just a benign growth in the skin epithelium, the outer layer of the skin, or mucous membranes. They can be caused by hundreds of different strains of viruses, all in the papilloma virus family. Can occur anywhere on the body, including the genitals. It's called genital warts. And then chickenpox and shingles. Chickenpox is a very common and highly contagious childhood disease, not as much anymore because there's a vaccine against it. And then shingles can come up later. But this is what it looks like. It causes very itchy red skin lesions. Now, normally chickenpox is self-limiting. It kind of clears up within about a week. It's caused by a herpes virus called varicella zoster virus, VZV. All right. Now, if you have chickenpox and it clears up, basically it's gone. It could be just gone dormant, and it can reactivate years later in the form of shingles, which are much more difficult to treat. Luckily, there is a vaccine against shingles as well. What about fungal diseases of the skin? Now, one thing you have to know, everyone, is fungal diseases in general are called mycoses. Mycology is the scientific study of fungi. So mycoses, fungal infections. Now, of the skin, pathogenic fungi are almost always opportunistic. Again, low virulence, they don't normally cause disease, but will if the opportunity presents itself. Now, they come in different versions, all right? Superficial. The fungal infection is just on the very surface of the skin, hair, or nails. Here's an example. The fungi here are feeding on oils produced on the surface of the skin. Cutaneous is a fungal infection in the skin. These are the most common. They're caused by fungi called dermatophytes, referring to the dermis of the skin, that produce an enzyme called keratinase we've seen before, which breaks down the protein keratin in the skin, hair, or nails. So things like ringworm, jock itch, athlete's foot are all cutaneous fungal skin infections. Subcutaneous is the mycosis is under the skin or even in the muscles like this, chromoblastomycosis, subcutaneous. And then systemic fungal infections affect numerous body systems. They get into the system, into the body. These aren't that common, but they can be very difficult to treat and quite serious, like pneumocystis pneumonia is fungal pneumonia. High mortality rate, difficult to treat, usually attacks immunocompromised patients. It's usually a secondary infection. Okay, what about diseases of the nervous system then? Let's start again with bacterial. The most common is bacterial meningitis. Now, the meninges are there's 3 layers of connective tissue around the brain and the spinal cord. If that becomes infected, you have meningitis, infected and inflamed. So this is a severe inflammatory infection of the cranial or spinal meninges. It's caused by Neisseria meningititis is the most common cause, and we refer to it as meningococcal meningitis. Now, it can move from the meninges into the brain itself, which is called encephalitis, an infection of the brain itself. Bacterial meningitis, everyone, is very serious. It can kill in less than 6 hours. That is a medical emergency. Botulism we talked about in the last chapter as a gastrointestinal disease, but remember the Clostridium that causes this, Clostridium botulinum, produces a neurotoxin. All right, so it also is a disease of the nervous system. In infants, as I mentioned in the last chapter, it can be particularly dangerous because it's not ingested. It can be picked up from the environment and grow in the intestine. So infant botulism can cause extreme muscle weakness, called floppy baby syndrome. Okay? It produces 7 different neurotoxins and can be quite dangerous. Tetanus is another one. This is caused again by a Clostridium bacteria. This is a neuromuscular disease caused by Clostridium tetani. The portal of entry is breaks in the skin, particularly puncture wounds. So if you accidentally stepped on a nail or had a puncture wound, you may want to go get a tetanus shot. It causes tightening of muscles, difficulty swallowing, and spasms, as seen here. Okay? What about viral infections of the nervous system? There is also viral meningitis, but this is typically much milder than bacterial. It's usually not that dangerous. Caused by several different viruses, particularly enterovirus. There's not a real specific treatment for it, but luckily it typically clears up on its own. It's not too bad in most cases. Historically, polio, or more specifically poliomyelitis, was a very, very feared disease. It's largely eradicated now. You can see here in 2016, it only existed in a few places in the world. Notice how it's gone down. It's still around, but it's mostly eradicated, but stubbornly lingering in a few areas of the world for various reasons. What eradicated this largely was 2 different vaccines, the Salk and Sabin vaccines. It's polio is caused by poliovirus through ingestion of contaminated water. Interestingly, the symptoms can range from nothing, asymptomatic, to fully paralytic. And sadly, many people were fully paralyzed, including the muscles that allow you to breathe, the intercostal and diaphragm muscles. So you'd have people in what's called an iron lung. Here's a patient in an iron lung. This mechanical respirator assisted the respiratory muscles that were paralyzed by polio, keeping this woman alive. She entered an iron lung at age 3 and remained until she died during a power outage at age 61. There are still a few people today in iron lungs. It's kind of a sad situation. All right, a third viral infection of the nervous system is rabies. Rabies is a zoonosis, so its reservoir is animals, caused by a virus called lysovirus. The reservoirs are infected animals, skunks, fox, raccoons, etc. See here. Now, you may or may not know this, but is rabies dangerous? Yes. Rabies, it can be a deadly disease, and in fact, once symptoms start to appear, there's often no treatment. So later stages, seizure, disorientation, hallucinations, paralysis, and death. Quick treatment is key. Again, it's often untreatable after symptoms begin to appear and will lead to death. The vaccine, this HDCV vaccine, was initially developed by Louis Pasteur back in the 1800s, and it's administered right away, 0, okay, 3, 7, and 14 days after infection. Okay, so quick treatment is key. Arboviral encephalitis as well. This is viruses transmitted by arthropods, especially flies and mosquitoes. Most cause only mild, cold, cold-like symptoms, cold or flu-like symptoms. Some can infect the brain. This is called viral encephalitis. And this is caused by arboviruses, West Nile virus, the most well-known. All right, now what about some other diseases of the nervous system? Fungal, okay? Fungi, luckily, everyone, rarely infect the nervous system. An exception is cryptococcal meningitis. This would be meningitis caused by a fungus. It's caused by this fungus, Cryptococcus neoformans. Similar to bacterial meningitis in how serious it is, including potential death. Protozoan diseases of the nervous system include African sleeping sickness. That's caused by this little flagellated protozoan we see here swimming among these red blood cells. It's called Trypanosoma brucei. It's a flagellated protozoan that causes a condition called meningoencephalitis, and it is invariably fatal if left untreated. Another protozoan one is primary amoebic meningoencephalopathy. You may have heard this called the brain-eating amoeba. There's 2 genera of amoeba here involved, acanthamoeba and Naeglerii, okay, pictured here. This is Naeglerii fowleri. They enter from warm, fresh water through the nose or cuts in the skin. Most of the time it's not a problem, but sometimes they can make their way to the brain, where they consume brain tissue and form very protective cysts that protect them from the immune system. This condition is almost always fatal, only 4 known survivors. Okay, what about diseases of the urinary system? Okay, now everyone, obviously the most well-known one here and the most common by far are UTIs, urinary tract infections. They are very common in females, much more rare in males, although they do occur. There's about 7 million cases per year, and as I've talked about before, they are the most common nosocomial infections, over 600,000 cases per year, often due to high catheter use, okay, in clinical settings and medical facilities. The bacteria trigger inflammation and pain in the urethra, bladder, ureter, and or kidneys. Most common culprit is E. coli. In men, that bacteria can infect the prostate gland, leading to a condition called prostatitis. And in older patients, especially, although anybody, but especially older patients, the bacteria during a UTI can affect the nervous system, okay, leading to confusion, hallucinations, and the like, which do clear up once the UTI passes. Glomerulonephritis is inflammation of the kidney itself, all right, typically caused by a group A streptococcus. All right, now let's look at STDs, okay? But first, what about non-venereal diseases of the reproductive system? So not sexually transmitted, but still reproductive system. Vaginosis. This is a bacterial infection of the lining of the vagina. It does not cause inflammation. Note the suffix osis, not itis. So infection, but not inflammation. What happens is the normal lactobacilli that are part of the vaginal microbiome are replaced by large numbers of anaerobic bacteria, often for reasons that are not fully understood, leading to this condition. We also have more commonly candidiasis, which are yeast infections. This is an opportunistic yeast, so fungal yeast, infection of the vagina. It's caused by several fungi, but primarily Candida albicans. And there's various even over-the-counter treatments for that. Okay, finally, let's look at STDs, sexually transmitted diseases. At least 33 million new cases occur worldwide each year. About half, though, of all cases go unreported each year in the U.S. So this is likely a very conservative estimate. Okay? Half of all STDs affect people under age 25. And do any of you know where another high percentage occurs? In retirement communities and nursing homes. Okay? So half of all occur under 25, but then there's a significant percentage happening in elderly populations. Risk is greatly reduced with safe sex practices. We often have associated with STDs as PID, pelvic inflammatory disease, a general term for inflammation and pain in the uterus, fallopian tubes, or ovaries, okay, in women. Now, what about bacterial STDs? These bacteria anyway, survive poorly on dry, cool, inanimate objects. But they do very well in warm, moist conditions. So transmission is through sex only. Gonorrhea is a big one here. Gonorrhea, interestingly, everyone, is a human-specific disease caused by Neisseria gonorrhea, or it's sometimes just called gonococcus. You can see incidences of gonorrhea in the U.S. The darker reds are higher incidence rates. So notice here, primarily in the South and in Alaska, interestingly. It's very symptomatic, gonorrhea is, and very symptomatic and painful in men, often no symptoms at all in women. It's treated with a variety of antibiotics, but concerningly, many strains of gonorrhea are becoming resistant to antibiotics. Syphilis can be a pretty bad STD. This is potentially deadly, caused by a spirillum or spiral bacteria called Treponema pallidum. It occurs in 4 phases called primary, secondary, latent, and tertiary. Okay, here's primary, it's a lesion on the penis here, and secondary syphilis. Now, in these 2 phases, it can be easier to treat. The disease is more susceptible to treatment. Latent, it might go primary, secondary, and then it disappears, but all it's done is gone dormant. It can stay dormant or latent, asymptomatic, you think it's gone, for decades. But then it reactivates in this tertiary stage, which is dementia, paralysis, heart failure, and death. It can be treated with penicillin-derived compounds, but again, tertiary is very, very difficult to treat. All right? Now, a third bacterial STD, remember we're still under bacterial here, is chlamydial infections. These are caused by this bacteria here, Chlamydia trachomatis, right here. And chlamydial infections, chlamydia is the most common sexually transmitted bacteria. Okay, here we see incidences again in the United States. Again, the darker reds are higher incidence. Okay, so a little bit more widespread than we saw with gonorrhea on the last slide. Now, chlamydia is asymptomatic in most women, 85%, but 75% of men have symptoms. It can cause that PID, pelvic inflammatory disease, in men, epididymitis, which is inflammation of the epididymis, a storage structure on the back side of each testicle, and it can even infect the testes themselves, a condition called orchitis. Babies infected at birth, and this could be a problem because remember, it's asymptomatic in most women. Babies infected at birth can develop a condition called trachoma, which is an eye disease that can lead to blindness. What about viral STDs? These are the most common STDs. It would include things like AIDS, herpes, genital warts, things like that. Those are the most common. What about protozoan? Sexual activity can transmit several protozoans. One is trichomoniasis, or shortened just to trichomoniasis. This is caused by this protozoan here, Trichomonas vaginalis. It's much more common in women than men. Normally, only women are asymptomatic. Now, on the plus side, Trichomonas vaginalis is normally kept in check by the vaginal microbiome, but if it's not, if the opportunity presents itself, it can cause the disease. Good news, treated with several oral antiprotozoans. Okay, everyone, that is it for this chapter, this last chapter on diseases of the skin, nervous, and genitourinary systems. And that's our last class here of the semester. So I hope you enjoyed these lectures and enjoyed the course. I hope you were able to keep up okay and you end up doing well grade-wise. But it's been a pleasure hosting these lectures for you and keeping track of the course and monitoring it. And again, I hope you learned a lot and got a lot out of the course and found it interesting. All right, everyone, until we meet again. Bye-bye.